Well, for weeks, patients have been flooding emergency rooms looking for care. Oregon health authorities reporting an increase in children sick with RSV and adults with COVID or the flu.
Today, we got an important update from the agency on what hospitals look like. And Fox 12's Paulina Aguilar joins us now live with the latest. Paulina?
Well, Pete, medical officials say treating kids with RSV every year is normal, but they say the combination of RSV, COVID, and the flu is creating a surge they've never seen before. It's overwhelming. Hospitals saying it's even worse than when COVID was in its prime.
Hospitals are full. The emergency departments are full.
Medical officials say operating above capacity is a first for Oregon.
We are experiencing very, very long wait times.
Flu season has begun earlier than normal. In conjunction with RSV and COVID, hospital beds have run out.
Many more children are being hospitalized with breathing problems than in past seasons, especially children under 2. Now, more adults will be at risk of not getting the hospital care they need.
Flu hospitalizations have increased since late October, up by 30% by Thanksgiving, affecting people 65 years and older. Patients hospitalized with COVID have risen from 235 to 347 in the past month. Officials say it's expected to peak at 408 by Monday. As flu cases rise, RSV cases thankfully hit the peak last month and are slowly decreasing. But Dr. Hassan says it is still challenging caring for the high numbers.
I've been preparing my staff that we should expect to be operating above capacity for at least the next month or so.
All 3 pediatric healthcare systems have been over capacity for several weeks. A problem in pediatric hospitals, a lack of personnel.
OHA has helped hospitals bring additional staff and healthcare providers from out of state. We expect more than 100 contract nurses and respiratory therapists to be in place in the next week. And OHA is pursuing up to $25 million in additional state funding for supplemental staffing contracts.
Pediatrics declared a crisis standard of care. That means if you go to the emergency room, care will look different.
So your child may have to share a room. Your child may have to be seen in the hallway.
If you don't feel you have an emergency, officials say there are other options, like reaching out to your doctor, getting virtual care, or going to urgent care. Though there is no mask mandate, officials say they highly recommend wearing them indoors, especially for children, and to stay up to date with your vaccines. Reporting live in studio, Paulina Aguilar, Fox 12 Oregon.
All right, Paulina, thank you. Well, today